Extract 1. Questions 1 to 12. You hear a neurologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I see you've been diagnosed with sciatica. Can you tell me more about how it started?
Good morning, doctor. Yes, it started about 6 months ago. I was at the gym doing some light squats when I suddenly felt a sharp pain shooting down my right leg. At first, I thought I had pulled a muscle, but the pain didn't go away. It got worse, especially when I sat for long hours at work.
I see. When did you first consult a doctor about this?
About a month after the pain started. I couldn't take it anymore. It was affecting my sleep and my ability to walk properly. My primary care physician thought it might be a lumbar strain at first and prescribed ibuprofen and rest. But when the pain persisted, she referred me to an orthopedic specialist.
What was the outcome of that consultation?
The orthopedic doctor suspected sciatica due to radiculopathy. He said something about nerve compression in the L5, S1 region. He advised an MRI to confirm.
When were the tests ordered, and what was the process like?
The MRI was done about 3 weeks after that visit. The pain was so bad by then, I had paresthesia in my right foot, and even coughing made the pain worse. The MRI showed a herniated disc at L5, S1, compressing the sciatic nerve root.
Understood. What treatments have you tried so far?
Oh, quite a few. First, I was on naproxen and cyclobenzaprine for pain and muscle spasms. Then, I went for physical therapy. They did traction and nerve gliding exercises. It helped a little, but the pain kept coming back. My doctor also gave me an epidural steroid injection last month, which gave me relief for about 2 weeks, but the symptoms returned.
How would you describe your current situation?
It's really frustrating, doctor. I still have radiating pain down my right leg, sciatic neuralgia, I think it's called. The dorsiflexion in my foot feels weak, and I sometimes get foot drop. I can't sit for more than 20 minutes without discomfort. I've even had to take leave from work because of this.
Given your condition, I'd like to discuss a treatment plan. We can try gabapentin for nerve pain and refer you for another round of targeted physical therapy. However, given the severity and persistence of your symptoms, microdiscectomy might be the best long-term solution.
Surgery? That sounds scary. Do you think it's absolutely necessary?
Since conservative treatments haven't provided lasting relief and your motor deficits, like foot drop, are concerning, surgery could prevent permanent nerve damage. The procedure is minimally invasive and has a high success rate for sciatica caused by disc herniation.
I see. I'll need some time to think about it. In the meantime, is there anything else I can do to manage the pain?
Yes. I'll also prescribe pregabalin as an alternative if needed. Also, nerve flossing exercises and postural adjustments may help. But if symptoms worsen, especially weakness or bladder issues, seek immediate care.
Thank you, doctor. I'll consider everything carefully.
Of course. Let's schedule a follow-up in 2 weeks to reassess.
Extract 2. Questions 13 to 24. You hear a diabetologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I see you've been diagnosed with unstable type 2 diabetes. Can you tell me what symptoms you first noticed?
Good morning, doctor. Yes, it started about a year ago. I was feeling extremely thirsty all the time, and I was urinating frequently, even waking up multiple times at night. At first, I thought it was just stress or dehydration, but then I started losing weight without trying. That's when I got worried.
When did you first see a doctor about this?
About 6 months ago. My family has a history of diabetes, so when the symptoms didn't go away, I went to my general physician. I also had blurred vision and felt fatigued all the time.
What was the outcome of that consultation?
The doctor ordered a fasting blood glucose test and an HbA1c test. My fasting sugar was 210 milligrams per deciliter, and my HbA1c was 9.2%, way above normal. That's when I was diagnosed with type 2 diabetes mellitus.
I see. Do you have any other medical conditions we should know about?
Yes, I have hypertension on amlodipine 5 milligrams and dyslipidemia. My last lipid profile showed high LDL cholesterol. I also have polycystic ovary syndrome, which my endocrinologist said increases insulin resistance.
Were any additional tests ordered after your diagnosis?
Yes, my doctor checked for diabetic neuropathy since I had tingling in my feet and retinopathy due to my blurred vision. Thankfully, no nerve damage was found, but my fundoscopy showed early signs of non-proliferative diabetic retinopathy.
What treatments have you tried so far?
Initially, I was put on metformin 1,000 milligrams twice daily, but my sugars were still erratic. Then, my doctor added glympyride 2 milligrams, which helped a little, but I started having hypoglycemic episodes. Later, I was switched to sitagliptin and then empagliflozin, but my postprandial glucose levels were still too high.
How would you describe your current situation?
It's been really frustrating, doctor. My blood sugar swings between 70 milligrams per deciliter and 280 milligrams per deciliter within the same day. Brittle diabetes, I think. I've been following a low-carb diet and exercising, but my glycemic control is still poor. I've also had a few episodes of ketoacidosis-like symptoms, nausea, vomiting, and extreme fatigue, but my ketones were borderline, not full-blown DKA.
Given your condition, I'd suggest a more aggressive treatment plan. We may need to start basal bolus insulin therapy, long-acting insulin, glargine, at night, and rapid-acting insulin, aspart, before meals.
Insulin? I was hoping to avoid injections. Is there no other option?
Given your uncontrolled hyperglycemia and beta cell dysfunction, oral medications alone aren't enough. However, we can also consider GLP-1 receptor agonists like liraglutide to improve insulin sensitivity and possibly reduce insulin dependence later.
What about surgery? I've heard about bariatric surgery helping with diabetes.
That's a good point to think about. Given your metabolic syndrome, the combination of high blood pressure, unhealthy cholesterol, and insulin resistance, weight loss surgery such as the gastric sleeve or bypass could really help manage your diabetes better. However, it's a big step, so we need to carefully check if you're a suitable candidate and understand any potential risks involved before making a decision.
I see. I'll need to think about it. For now, what can I do to stabilize my sugars?
Along with insulin, I'll adjust your metformin and add empagliflozin for better control. We'll also monitor your renal function and electrolytes closely. Most importantly, continuous glucose monitoring will help track fluctuations.
Thank you, doctor. I'll follow your advice and consider the options.
Great. Let's schedule a follow-up in 2 weeks to reassess. If your sugars drop too low or spike dangerously, seek help immediately.